Welcome back to the telethon. Today we have Laura and her mom, Annette. Laura was born with CDH, and I'm excited because I don't know Laura and I don't know Annette. And so I get to hear their story right from the beginning, just along with everybody else. So welcome, you guys.
Hi. Hello.
Okay, so tell me how this all started.
I don't remember, so I'm gonna let her take this part.
It all started after she was born, and they cut the cord, and she turned purple. That's how we found out there was a problem.
Oh my word! Okay, what year?
And
what year were you born?
1987.
1987. Oh my goodness! Wow.
So that was back before a lot of things were known.
Right.
No ultrasound was done.
I never had an ultrasound, so I had no idea if there was any problem. Like I said, until they cut the cord and she turned purple. And they whisked her away, and my husband went down to find out what was going on, and I think I just kind of was in la-la land. I'd been in labor all night. Wow. And kind of laid back and went to sleep, I think, truly. And within 3 hours, they came back and told us that they found the problem and wheeled me down there so I could see her and slapped the x-ray up on the machine, and it was quite the shocker because there were her intestines and everything up in her chest cavity, and they told us what was wrong and said they needed to operate immediately.
Because you're much more educated.
So within 3 hours, we were in the operating room.
Oh, wow. Really?
Mm-hmm.
Wow. So had you ever
in November at a conference, and
never in my life.
No,
immediately
until they have it.
No.
we connected on our
Even now, when I say it, people have never heard of it.
Right.
Put us in a whirlwind of research.
I do.
And
Okay,
there,
so
I think we have her.
I'm interested in your perspective as an adult, and I know you've had some children, and I know there are a lot of moms of little baby girls and a lot of teenage girls that are interested to hear how that went, because that's when people talk to me when they're just first getting their diagnosis and they're diagnosed and they have a daughter. One of the very first questions they ask is, what about having children? Can they have children? So I want to hear how that was for you. That's where I want to start with you, Laura.
Okay. Well, I obviously all my childhood, I always wanted to be a mother. I knew in life that I would be a mom, you know. But as I got older, it really became more of a realization that we didn't know what I would be up against. I saw my surgeon until I was 16 before he released me. And I've had no further complications directly related. I've had some other adhesions and stuff from surgery and like that. But he assured me that they didn't mess with anything fertility-wise when they were doing all of my repair and surgeries. But with all the scar tissue, there's no telling, you know, what's going on in there. Mm-hmm. And so I actually met my husband when I was 17, and that was one of the first things I told him. I said, I was born with this problem. I have scars all over my body. You know, being 17, you're kind of shallow in the sense of like, oh, that may scare him away.
Yeah.
You know, so I'm very upfront about it. Mm-hmm. And I have these scars, you know, first date, let's get married and have kids. I told her that theory. I said, FYI, I don't know if I can have my own children. We just don't know. So if you're not open to the idea of adoption someday, that's a deal breaker for me, because we don't know what's coming down the pipe. So, and he was okay with all of that. Obviously, we've been married for 13 years almost. So, anyways, fast forward, we conceived my son naturally, but it took us a long time. And I carried him to term. Mm-hmm. He was born at 38 weeks. perfectly healthy. He did sit sideways in the womb, transverse, pretty much the whole pregnancy once he was large enough to not move around anymore. He sat sideways, and so he did have what is called torticollis, which is a problem with his neck, but it was solved with physical therapy for we did about 6 months of physical therapy, and he's perfectly fine now.
You were under the care of a maternal fetal
Yes, I saw a maternal fetal specialist and did level 2 ultrasounds every other week. The whole, like from 17 weeks on,
Really?
I was seen every other week, and I was on blood thinner, but that's unrelated to the CDH.
Oh.
I had blood clots at age 18 that were unrelated to CDH, so.
My word. Well, so they were watching you close. You had a high-risk doctor.
Yes.
A close eye on you.
I had both an OB and a high-risk OB.
Okay, that's good information for these moms.
Yes, and I highly recommend forcing that issue as somebody with that medical background.
Was that
well, you pretty much go ahead. Well, you pretty much knew that going in that that's what you were going to have, so that wasn't a shock.
Well, right, but I'm saying if your OB says, "Oh, it's not a big deal, I'll watch you," like I would suggest forcing the issue.
Okay. Did you run into that problem? Did you?
I didn't. No. Mine was very open to whatever I wanted to do. She was behind it because she was of the opinion that I knew my body better than she did.
I love it.
And I did too, because I've dealt with it my whole life, and you met me yesterday. Like, I know you're a medical professional, but I've dealt with my body my whole life. I know what's normal and not normal. So she was very, and I've actually had different OBs for both children. So both of my OBs, though, were very
supportive.
Well, they listened to what I had to say because they'd never had a patient with CDH. Imagine that. And so then whenever I came to them, that was my first question too, was this is my background. Do you feel comfortable having me as your patient? Because if you don't, you need to say so, and I will go somewhere where they're confident. And so
that's good that you asked that. So your first was transverse. So does that mean a C-section? Did you have him C-section?
No.
No.
He turned around. He turned, and I had a completely, I mean, I had an epidural, but completely natural birth. And he was born, I labored less than 12 hours and pushed for 15 minutes, and he was here.
Wow.
I had like the picture perfect. Everybody wants to hear my story on how to have a baby. So I was induced at 38 weeks, but that was also related to the blood thinner.
To have a
controlled delivery versus emergency situation.
Okay, well, tell me about your second pregnancy. How did that go?
It was a little different. She was conceived with IVF. My children are 5 years apart. It took us almost 4 years to conceive my son but we were young, so we weren't really worried about it then. And then as we went on, we got a little more worried about it, and sought assistance. And it took us 2 rounds of IVF to conceive my daughter. And I did have an ectopic pregnancy with my first round of IVF. They think due to scar tissue, and my tubes were mangled with some scar tissue from my surgeries.
Right.
And so I had an ectopic, which they normally tend to laparoscopically, but because of scar tissue, they couldn't get the camera and like the rods in the places they needed to go. So they opened me from belly button to pubic bone.
Oh, wow.
All the way up to tend to that. I spent, a week in the hospital?
Well, one thing you probably need to throw in that makes it somewhat different than normal CDH is, she had the repair surgery, and 4 days later, and we'd been watching that whole time, knowing something wasn't quite right, and 4 days later they found out that her intestines, they think with the original surgery, had been perforated, and so she had what's called necrotizing enterocolitis and had major infection in her abdominal cavity. So that's why they think there's so much scar tissue.
Well, they went back in how many times? 5? 4?
I kind of truly lost track, but they said that could have had a little bit to do with, that was where I always as a mother was scared, because they told me, due to all that infection, they might have damaged the eggs.
Oh, wow.
That young of an age. And so that was always my fear as her mother, to how do you tell your daughter that?
Right.
You know, and when. But anyway, that's some of what led to the massive internal scarring, is from that situation.
Mm-hmm.
So you can take over it.
Well, I'm curious what you would tell, because I have a 17-year-old son with CDH. What would you tell him and all the other, let's say, teenagers, early 20s, you know, young adults? What would you tell them that you've learned as an adult CDH survivor that might be helpful to them?
You know, I feel like my case is so, I have very little lingering effects from my CDH, I feel. We always joke that I think I'm normal because I've had no problems.
Right.
And the few problems I've had have been fixable, but she thinks I'm way less normal than I think I am. You know, as a parent, as a CDH mama, I totally think I'm fine because I've never known any different. I was well for for good by the age of 3. So, to me, I'm totally normal and healthy, and to her, I'm totally not.
Well, we chose to raise her under the pretense you are perfectly normal and there's nothing you can't do. And I mean, she wanted a bikini at age 4, and we had to swallow. How do you do that? You know, when the kids are going to be so cruel.
Right.
And we said, well, if she wants one, she gets one, and she's worn one ever since.
Wow, that's
so. She's
I have no
very
problem.
confident in her scars, and I always told her, I said, you're alive because of those scars.
Right. Right. I love
And
that.
that would probably be the biggest thing, especially for girls. I don't care what other people think. I wouldn't be here without them, so I wear them very proudly. That those scars make me who I am. I've got them. I've got one. I don't know if anybody can see it. I've got a large one on my neck. That one is probably the one that people notice the most often. And I have people say, "What's on your neck?" Like they give you, "Oh, what's on?" And I'm like, "It's just a scar." And then they're intrigued, and that lets me share what I went through, what I had that nobody's heard of, and share the awareness and, raise awareness. And I feel like, don't be shy. From age 4, I didn't worry about what other people would say to me. I told people when I was little, I remember telling people that I got bit by a shark. I got bit by a shark. It's cool.
I heard that.
Yeah. I don't know why that was like my chosen story, but it made me cool. So I guess. But even to this day, I had a friend growing up that is a nurse now, and she would tear my shirt up and say, "Do you want to see her scars? I want to show you her scars." And she would pull my shirt up, and I would be like, maybe they don't want to see that. You don't know. But it didn't bother me. I'm happy to, if you want to see it, I'll happily show you. So I just feel like be confident in your body, be confident in your personality, everything. I'm the way I am because my parents raised me that you are no different than anyone else. Yes, you have scars. You've always had scars. We have one picture of me without scars. One. And it's a Polaroid.
And it looks
that they snapped. before I went into my first surgery.
Right, and it
looks
like you're missing
there,
right?
Yeah, it's not me. That's not me, you know.
Right.
And so I mean, like I said, especially for girls, teenage girls. I don't know if boys have the same. You know, sometimes for boys, scars are cool. So, but for girl, I would just say own it. Be confident, and don't let other people put you down. You know, put you down for it, because they make you stronger.
I love that attitude. That's incredible.
I have that attitude about everything in life. Tell me I can't, and I'll show you I can. So.
That's so great. And well, I mean, I think, you know, as a CDH survivor, you clearly had that fight in you right from the beginning. You knew you had.
And my mother has paid for it a lot.
I always say a stubborn girl is hard to deal with, but it serves them better in life when they're grown.
That's very true. I have a few of those stubborn girls too. That's so great.
Yes.
Well, I just want to thank you guys for taking time to do this interview for the telethon. I really appreciate it. You guys are amazing, and you and I are in the same club, and I love it.
It was probably I always say my daughter's just fine, but I will never be.
Right. I think I'm normal.
Mm-hmm.
Yeah.
So.
Things happen when you see your baby on life support, right?
Right.
Yeah.
That's true.
It's not a fun thing, but here she is now today, and you have grandbabies, and you know, I think that's a really good takeaway from this interview is you can go on to have a normal life, whatever normal is. I mean, honestly.
Right. We all have a different normal.
Yes, absolutely.
Right. But when people first get diagnosed, they hear and see the worst case scenario, and I think it's really great to get these positive stories out there and say, you know, but there is this side too. I mean, both sides can go either way. But I'm hearing a good positive story to say, you know, things can be okay. There can be.
Well, it's that thing of giving somebody hope when you get the diagnosis. I imagine you think there is no hope.
And I'm 31 years old. When she went through it, there was nobody. You know, nobody knew what she was going through.
Even the surgeon.
There was no support groups. We'd never even heard of this.
All the different therapists and everything.
And I didn't meet another CDHer until I was 25, because Bo was about 2.
Mm-hmm.
Till I was 25 years old, I'd never met another person with CDH.
Wow.
And so for me, I didn't, you know, I had the attitude that I didn't care that I was the only one. It's fine. But it did intrigue me that there's that when you learn there's others out there that have what you have. Like,
right.
We went to our first meetup. I was about 25 years old, and I was the oldest one there.
Yeah.
You know. But again, from that first moment, I gave those mamas hope of like, here you are as an adult, living a healthy, you know, for the most part. I have my moments. If I get sick, I go to the hospital.
Right.
But otherwise, a very healthy individual that I don't generally get sick. If it is something, I go big.
Big. Yeah.
Had a couple of adhesions and bowel obstructions from scar tissue. And so, but no C-sections. Both children were vaginal deliveries with no complications and healthy little babies.
Wow.
So
that's very encouraging. I'm glad that we got to have this chat. And I kind of took all the time about, you know, your reproductive life, but really there's so many of us out there that, you know, get the questions and say, well, can my daughter have children? And, you know, it's good to hear these stories. So I really appreciate you sharing story with us, and I appreciate you taking the time to visit today and join the telethon.
Yes.
So,
me too. Thank you.
Yeah, I'm going to let you go. Your husband's keeping the kiddos at bay. I understand that.
I know they've been quiet this whole time. I'm impressed.
Yeah, you can tell him that we're still still filming. It doesn't matter. You can
Yeah, it took 4 hours, son.
Oh, well, Laura and Annette, it's nice to meet you. I'm so happy to have
You as well.
time with you guys, and you guys have a good night, and I'll talk to you soon.
Thanks.
All right, thank you. Good night.
Bye-bye.
What's up, going? It's your boy Sean Kingston, and this is for CDH International. April 19th is Congenital Diaphragmatic Hernia Awareness Day. CDH affects thousands of kids per year, 300,000 since 2000s. All right, only 50% survive. So please donate to help the kids at www.cdhi.org. You know what it is, all right? Big up, Sean Kingston says so. You're way too beautiful, girl. Shawty's like a melody in my head that I can't keep up. Got me singing like, you know what it is, Kingston. Body up.
Hi there, it's Melissa Joan Hart. April 19th is Congenital Diaphragmatic Hernia Awareness Day. CDH affects thousands of kids a year. 300,000 kids have been affected since the year 2000. Only 50% survive. Please donate to help the kids at www.cdhi.org. cdhi.org.